So let's take a look at the bones of the skull and the landmarks. When we talk about the skull, we actually have to divide it into two parts here. We have to divide it into the cranial bones. Those are the bones that are going to surround the cerebral cortex itself. And then the facial bones. Those are the bones that are going to make up what we would consider to be the face. And so when we start by looking at the bones, we'll start with the cranial bones. And we have reference here with the sphenoid, the frontal bone, the parietal bone, the temporal bone, and the occipital bone, looking at a lateral view of the cranial bones themselves. We'll come back and look at some of these other bones as well as some of the landmarks here in a second. Now let's look at it from a frontal view where we see the sphenoid, frontal, and parietal bone. We will also have the lacrimal bone. So let's take a look at some of the frontal bone landmarks of importance here, and then we'll move into landmarks of some of the other bones. So some of the landmarks we should be aware of are the supraorbital ridge and supraorbital foramen. And then we should also be able to identify the optic or ocular fissures. There is a superior fissure and then an inferior fissure. The supraorbital foramen is going to allow for some of the nerves to pass through the cranial bones and innervate the face. The supraorbital ridge is going to be an attachment site for the frontalis muscle. The ocular fissure is going to allow for the extraocular muscles as well as blood vessels to head out into the orbital region. So we're going to turn back and look at the skull from the lateral aspect here, and we'll start with looking at landmarks of the temporal bone, in which we have the mastoid process, the styloid process, the external auditory or external acoustic meatus or canal. You can use those terms interchangeably. The reference for the terms are going to be based off of which anatomical atlas you're using. We will also see the zygomatic process of the temporal bone. This is different than the zygomatic bone itself. And we will see the temporal condyle, which is going to be the articulation spot for the temporal mandibular junction or temporal mandibular joint. In between the styloid and mastoid process, we have the styloid foramen. That's going to be an exit point for the cranial nerves, particularly the trigeminal, one of the branches of the trigeminal nerve. Moving to the occipital bone, we will have the occipital condyles, which will be the articulation point between the occipital bone and the atlas, or the occipital atlas or atlo-occipital junction. We have the large opening for the spinal cord or the foramen magnum. We then have the attachment sites for all of the cervical extensors, as well as the ligamentum nuchae, which is the occipitus. And then we have the beginning of our sutural connections between the bones, and the most posterior or dorsal of them would be the lambdoid suture between the occipital, temporal, and parietal bones. Changing the viewpoint a little bit here, we're going to see the lacrimal foramen. And then continuing on with some of the sutural junctions between bones, we have the coronal suture between the frontal bone and the two parietal bones. And then we have our sagittal suture between our two parietal bones. Let's now head internal into the cranial bones. Notice we have our frontal bone, temporal bone, occipital bone, and sphenoid bone visible here. We're going to add one more bone to the visible bones here, and that is the ethmoid bone. So we're going to change the orientation of the skull a little bit here, and let's take a look at the landmarks, and we'll start with landmarks of the sphenoid, in which we have the greater wings and the lesser wing. The greater wing is going to continue across the breadth of the skull. The lesser wing is just that small little region of the sphenoid where it is going to articulate with the frontal bone. At the junction point between the greater wings, we have the sella trasica. The sella trasica is going to be the region that houses the pituitary gland, as well as the area of the optic chiasm. Speaking of the optic chiasm, we have the optic canal or optic foramen. That is going to be the exit point for cranial nerve number 2, or the optic nerve. Then we have 3 small foramens, which are going to be exit points for some of the cranial nerves, such as the foramen ovale, foramen rotundum, foramen spinosum. Then we have a couple of very important foramens and canals for blood vessels, which include the jugular foramen and the carotid canal. Very visible in the skull is the foramen magnum. Within foramen magnum, there will be 2 small foramens, the hypoglossal foramens. Moving up to the ethmoid bone, we have the crista galli. And just lateral to the crista galli, we have the cribriform plate and the olfactory foraminas. This is where the olfactory nerve, cranial nerve number 1, will exit into the nasal opening. Okay, we're going to flip the skull over here. And in flipping the skull over, we will be able to see the stylomastoid foramen. We will be able to see the occipital condyles. We will be able to see the foramen magnum and the accipita's, foramen rotundum, the jugular foramen, and the zygomatic process of the temporal bone, as well as the temporal condyle, which is going to allow for the articulation points between the temporal bone and the mandible.